Hello, and this message is about and for doctors. So, in my research this year on health, on nutrition, and trying to understand what I can do to improve my health so that I don't die in the next, well, at least in the next 5 years, because it's going to be 5 years before my son is an adult. But hopefully, maybe 20 years, and hopefully I'm not going to end up with dementia like my mom and some of my other family members. Because, I visit my mom every week, and it's really sad. She has 3 degrees, and now her intelligence level is like maybe middle school or grade school, depending on how she's doing that day. So I really hope I can live for many more years for my kids and not end up in a nursing home. So I've done a lot of research, and one of the things that absolutely shocked me is well, doctors are not properly trained on nutrition. Doctors get hours worth of training on nutrition, bare minimum. They spend huge amounts of time on anatomy, on surgical procedures, and all this other stuff, all the different parts of the body and how they function and how you can repair them, and medications. And they spend a lot of time learning about medications and on an ongoing basis. They go through certifications on a regular basis. But nutrition is glossed over, minimalized, and it doesn't make sense. Why doesn't it make sense? Well, because at this time, the top ailments that we have are either directly caused by or correlated with our diets. When I say diet, I don't mean, I'm going on a diet because I want to lose weight. I mean the way we eat and what we eat. Okay, how much, how often, and what kinds of foods you consume. That's diet. Okay. So heart attacks and strokes and diabetes and metabolic disorders and all these other things, obesity, are a direct result of our bad choices in consumption of food and beverages. And my family has a history of heart problems. And so I have tried to do a good job, but as a consequence of my reviews channel, I kind of screwed up and exacerbated problems with palpitations and created problems with too much plaque around my heart, and also it has contributed to problems with memory loss that have been caused by too much fat in the crap that I was reviewing. And on top of that, I also have had some other health-related issues caused by those things, such as at one point, I was reviewing so many chocolate bars per day that I was consuming so much sugar per day that it was altering my personality and my moods. I was becoming emotional. Like weepy, depressed, confused, that kind of stuff. And it was just because I was consuming too much sugar for my body to handle, and it was messing me up. And as soon as I stopped consuming that much chocolate, and I'm not talking about eating entire chocolate bars, to do these reviews. I was taking small amounts of each bar that I was doing, but I was doing 5, 10, maybe even 15 bars in a day, taking, maybe 1/3 of that bar or 1/6 of that bar and eating it, depending. And then on top of that, I was doing comparisons between bars. So, I probably was eating a couple of bars worth of chocolate per day, sometimes, maybe even more. And so all of these things have conspired to mess up my health. And so my health adventures have pushed me in the direction of learning about health. And that's how I found out that doctors get maybe a day's worth of training on nutrition. So when you go to your doctor and your doctor has a choice between trying to educate you on how you should be eating or giving you a pill, Most doctors will know lots more about medications than they will about how to educate you or what to give you to do to help you with your diet. And there's a lot of pressure from the pharmaceuticals industries, directly and indirectly, to encourage doctors to put you on medication. I mean, there are incentive programs. I mean, they will, I mean, I guess you could say they get kickbacks. They will have, there will be meetings for doctors, and the food and other things maybe will be sponsored by pharmaceutical companies. So there's a lot of direct and indirect pressure, sometimes pressure from above the level of the doctors, the administrators and managers and stuff, to push pills. And since doctors are not educated, and even specialists, like my cardiologist, when he saw that I had atherosclerosis, the only thing he could tell me was, go on the Mediterranean diet. I said, well, what kind of stuff should I be avoiding? I mean, what can you tell me? And he's like, I don't know. I was never trained on nutrition. I can't help you. Go on the Mediterranean diet. That's a cardiologist. Cardiologists deal with food-related heart disease every single day, but he couldn't tell me anything else. And that is unacceptable. If you are a doctor, it should be absolutely mandatory. Any doctors, GPs or specialists, I don't care. You should be an expert on nutrition. Why? Because the vast majority of the most common diseases that you're going to deal with now are related to nutrition. Either malnutrition, excessive, or just bad eating habits. All right? So if you're going to a doctor and you have a food-caused illness, and there's a long list of them, far more than the ones I listed. I mean, urticaria and some of the other skin conditions are caused by it, and ulcers and all kinds of things, constipation, heartburn, or indigestion and other digestive tract symptoms are all part of it. In fact, if you're taking medication and you're not consuming something before you take the medication, because food and beverages in your stomach will help to buffer your stomach from the sometimes caustic or otherwise destructive effects of some medications. Some medications are perfectly safe to eat on an empty stomach, but others are not. And I am a testament to the consequences of that. Now, I'm not even talking about food here. I'm just talking about how medications, when consumed incorrectly, can cause damage that can result in problems with other parts of your body. And I just put it very briefly. I used to take my allergy medicine without any food in my stomach, and over time it was damaging my stomach and my intestines. It led to colitis in my intestines and irritation in my stomach. And that was causing my immune system to try to react and contain those problems in my digestive system. But as a result, my immune system was so busy fighting that problem that it couldn't fight off the infections I developed in my ears with two different kinds of funguses. And I had wounds that were not healing. And I had other problems that were happening that would not heal up, all because of that. So, yeah. If you go into a doctor's office and your doctor doesn't have extra training in nutrition, especially, preferably they have like a second degree in nutrition, or at least they have ongoing, regular, extensive training in nutrition, in diet, they're not going to be able to help you with illnesses that are caused by what you eat and how much you eat of it and how often you eat it. They will do what they can to give you pills. But pills often cannot cure a problem. They are a treatment that might suppress things. Sometimes suppression is good, but sometimes suppression can just be a bandage hiding a wound that is infected, so to speak, which is to say that sometimes a medication can hide a serious condition that really needs to be treated by changing the way you eat. So cirrhosis of the liver is another example, or fatty liver. These are all things that are caused by both alcohol, but also by eating foods that have lots of fructose in them. And this is not really so much about eating fruits, but in eating the refined fructose, like high fructose corn syrup, and other types of sugars that contain a lot of fructose in them. Now, honey, for example, has like somewhere in the area of 50% fructose in it, which makes sense because of what they're coming from. They're coming from flowers, and flowers produce fruits. But if doctors don't understand nutrition and correct diet, and if you go to see a doctor and the doctor's obese, then clearly they either don't know or don't care. Maybe they're dealing with some mental health issues, and I'm not trying to shame them for that. Clearly, they cannot help you other than to maybe give you exercises or to make some general suggestions about food, and they can't certainly do much more than that other than pills, medications. So you can end up on numerous types of pills, and it just goes on and gets another pill is added, another thing is added, another medication is added, and you can end up with all these different pills. Like my goal right now, I'm on between skin problems and allergies and heart-related stuff, I'm on 10 or so different medications. So one of the goals that I have is to get off of as many of those through my vegan diet as possible. So let's see, I've got a thing for heartburn, acid reflux, and I'm hoping that eventually I'll be able to get off of that, although there's a family problem with having a sensitive stomach, so I may never be able to get off of that. I'm also on blood pressure medication. I'm on a statin, and I'm on aspirin to thin my blood. So that's 3 medications related to my heart. And so I'm going to get off of those. I'm absolutely positive that I'm going to get off of them. I don't know how at this time to know when I can get off of them, but I will get off of them. One thing that will tell me is if I go for a month or two without having any twinges around my heart and without having any measurements of my blood pressure that show high blood pressure for maybe 6 months, I can start looking at the getting rid of those 3 medications. So that's 3 right there. Once my daughter moves out and takes her cat with her, I can get off of, maybe I have 4 different allergy medications. Maybe I'll be able to get off of all of them. I wasn't on them before we had the cat. So theoretically, I'll be able to get off of them once she's gone with the cat. So that's a total of 7 medications out of the 10. And then the other medications, I've got 2 of them are related to my skin problems. I have seborrheic dermatitis and intertrigo, I think it's called. And some of that is undoubtedly related to things that are not about diet. So I may not be able to get off of all of those, but if these are funguses, so if I treat it long enough, theoretically, if it's not related to diet, or if it is related to diet and my diet is right, then I'll be able to get off of those 2 medications. So that's 9. And so that just leaves the one for the acid reflux. So I'll be back to 1 medication, which I've been on, that medication for many years now, because I got tired of always having acid reflux. I'd eat something like salmon even will give me indigestion. So I want to go back to that, just having 1 medication instead of having all the medications. And there are lots of people out there with success stories where they've changed their diets and they have been able to get off of most, if not all, of their medications. They've gone from being extremely large and diabetic and type 2 diabetic, I should say, and all kinds of other things, to being slender and healthy and not diabetic. And so I'm inspired by these stories. I know that every person is unique. Every person's going to have a different experience. But getting back to the topic here is, if you're going to go to see a doctor, make sure that the doctor you're visiting knows about diet and nutrition, or have them bring in a nutritionist, a dietitian. Be careful, not all, I have a problem with some dietitians and nutritionists, because some of them are quacks, just like some doctors are quacks. So do be careful. But if you're a doctor, you absolutely should be pushing the AMA to require that all doctors are certified in nutrition and diet every year. I don't care what their specialty is. We're talking cancer, and we're talking so many other diseases that are caused by or affected by what we eat. There's absolutely no excuse for medical schools, universities, colleges, whatever, to continue to teach doctors how to be doctors without teaching them about the root causes in detail that are related to food and beverages. No excuse. If your university is not doing this on more than a cursory basis, you should be ashamed of yourselves. You should shut down your medical program and have your head examined, because it's disgusting. It's absolutely disgusting. I mean, these companies are destroying entire nations of people because doctors aren't trained correctly on nutrition and diet. Ooh. Sorry, I get really worked up about things like this when I see horrible injustices that are so widespread that people don't even recognize that they're a problem anymore. So thank you very much for watching, and hope you have a great day.